Okay.
Yes.
So, hi again. For those of you who haven't been watching our Comedy of Errors, we've been having all sorts of fun trying technical problems with Facebook, trying to add people to the live, and that didn't work out. So we're doing the Zoom recorded. So this is Missy, my friend, and we met. Gosh, Elsa is 7.5, so probably 8.5 years ago. No, 8 years ago, when I was pregnant, and Missy was in physical therapy school. She was my student and came to our clinic over at Pro Club. And I was hugely pregnant, so I just was like trying to give you as much manual work as possible. Like, oh, you do it.
Which was amazing because I got so much hands-on work.
Do it like this. Okay, now I'm tired. You do it.
Yeah. Yes.
And we were just discussing in one of the various failed technical attempts that just today, and I shared it on my page, that a physical therapy clinic over in Redmond, I think it's a therapeutic associates branch,
yep.
Who's managed by Dan Anderson, posted my information because he's partnering with my Business Among Moms networking group. And it turns out that he went to school with you. So small world.
No, that's awesome. He'll be a fun one to work with.
I haven't actually met him in person, but like some digital communications, I sent him my paperwork anyway. So that's been fun. And again, it's for domestic violence. So we're doing Ride the Wave on Sunday. I'm actually doing the walk just because I didn't feel like riding my bike. But
yeah, nice.
I'm sorry, what was that?
Is the Pro Club still open?
The Pro Club is still open. They did close this year the PT clinic at the Seattle location.
Okay.
So Leah and Anita had been there the whole time, but they've moved on.
Got it.
To new places. And then Anita actually got a job in Shoreline with someone I went to PT school with. So no, when she didn't realize it, and I didn't realize it until she was there for like 6 months.
Yeah.
I'm like, oh wait, we know each other.
Oh, I was
anyway.
At the REI right next to it when I was in town a couple weeks ago, and I was looking for it, but I couldn't find it.
Oh yeah, I think it's still there.
Yeah,
it's not like super well, it's hard to locate.
Yeah.
All right, so Missy's from California. She's a beach girl.
Yep.
And and she's a physical therapist. And pretty much from graduation, you opened your own clinic and had a private practice. And you've been located in CrossFit gyms, correct?
Yes, that's what I started in, definitely.
So are you still located? Is your business still located at the CrossFit gym, or?
Yeah, so when I moved to Denver about 3 years ago, I had my treatment table in my car and was going to 6 or 7 different CrossFit gyms, just driving around and treating patients.
Oh.
And now I have 2 main locations. So one is a CrossFit gym that also has other practitioners working there. It's called Progress Move. And then the other one is called Denver Sports Recovery, which is kind of like a fancy athletic training room with a bunch of different practitioners too. So
awesome.
Stepped up a little bit.
And so then the other thing that she's added to her practice is working with essential oils. And I do want to get to talking about that, but before we move on, I thought I'd ask you a couple questions about working in CrossFit. And I'm assuming that you do CrossFit as well?
I do. I don't do as much as I used to, but I'm about maybe 2 to 3 times a week. So.
And what do you like about CrossFit?
I love the functionality of it. I use it as my rehab protocol for a lot of patients, just being able to take people down to the basics of squatting to fix their low back pain, that kind of stuff. And when I was in PT school, I think it was after our clinical rotation, but I started coaching CrossFit and realized there was a lot kind of lost in translation from what you were supposed to do and what was actually happening in the gym. So my mentor, Kelly Starrett, he's a CrossFitter and he's a PT and owns a CrossFit gym. And he just had this vision of helping CrossFitters move better from the beginning rather than waiting for the injury to happen. So that was my goal, and that's why I'm so passionate about working with that population.
Yeah, and I think probably the first time I heard of CrossFit was sort of from the opposite end, that, you know, people kind of getting into it, not having good technique, not being coached properly, and potentially setting themselves up for injury. But then now I know you, and also the Movement Maestro, I took a class from her. I think she did a taping course.
Oh, cool.
And or a functional exercise or something. And I followed her, and she's definitely she's got a good dynamic style of talking, and it's a good person to take a class from if you're interested. But
yeah,
she's also, you know, worked within CrossFit as well.
Yeah, it's really sad how, because if you look at the creator of CrossFit, it was meant to be, you know, movement specific, slowly transition to more weight. But you get a bunch of adults who used to be professional athletes or played in college, and they just want to be at that high level right away. And so there's just a lot of ego and that kind of stuff, but there's still some good gyms out there.
Good. I'm glad to hear it.
Yeah.
So, and then now about the essential oils. Well, my first question, and I'm just going to skip straight to it, and then I'll do the other ones. But my first question, and what I've been wanting to know, and you even suggested as a area of topic, was how do you incorporate that into your physical therapy practice? Because I'm interested in that. Like, I know that some essential oils can be used for like cleaning down the mats and things like that. But as far as patient care, how are you blending these two interests?
Yeah. So this actually ties into what got me into oils. So I was, as you know, everybody comes to you with pain, and they're popping 5 to 10 Advil, ibuprofen every day, and just trying to find whatever they can to block that pain. And all of the research shows that it just really starts to wear down your gut. There's a lot of issues that are created in your gut from taking those medications, beyond all the other toxins, and how it actually will stop part of the healing process and potentially create a chronic injury. And so it was after I had moved to Denver, and I was just on this mission. I was like, I'm in Denver, there's got to be something more natural that I can work with my patients with. And so I went to Whole Foods and got some essential oils and was playing with them. And in the CrossFit world, there was a lot of women who are now my really good friends that were using essential oils. And I learned very quickly that quality is huge, because the FDA doesn't regulate them. So a lot of the essential oils on the market are synthetic fragrance. So people kind of think of them as something that smells good versus a therapeutic benefit. And I wanted the therapeutic.
Right.
So that's how I found doTERRA. And I started to, there's this recovery blend. It's a blend of 8 different oils, and it helps with tissue healing, swelling, nerve regeneration. It's supporting all of these processes that we want to happen while someone's healing. And I started using it with my patients, and I was blown out of the water. Patients loved it. They loved the smell, but it was also working, and they were able to kind of start to cut down on that medication. So that was a huge part of it. But the other really cool thing is, you know how when we work with patients and they're not sleeping well, right?
Yeah.
They're in pain.
If you're sleeping well, you're not healing.
Exactly. So they're not sleeping well. They're probably eating pretty bad because they don't feel good. Stress levels are high, maybe a little bit of depression. So being able to recommend a natural remedy for that stuff has been awesome to be able to be like, hey, use this to help with your sleep and see if this helps with your mood and that kind of stuff. So
for sure, pain works. Chronic pain, at least, works the same chemical process as depression in the brain. So you know that, but I'm sharing that with our viewers because not something that we've been educated on. And also eating, you mentioned, I know some of, my patients, if they're not able to be active, they're not able to go out and play soccer or run or whatever it is that they enjoy, then they're sitting at home, feeling depressed, feeling in pain, and then turning to food. And so it's just sort of a negative spiral.
Yeah. And it's like you can only get someone better so much with what we learned in school. Like,
yes,
because then you start to tie in all that stuff that you just mentioned, and that's where at least the lasting healing comes. So
yeah, you've got to have a holistic approach.
yes.
I definitely had gotten to that point where I was getting frustrated, and I think we touched on this a little bit in my last interview about just people who are coming from an unhealthy lifestyle, not necessarily people who are from a healthy lifestyle feeling depressed about their pain, but people coming from an unhealthy lifestyle, and then you're trying to heal them and their bodies are not in position. It's not just okay, I do these therapies, but it's like, oh, well, now we have to back this up and look at your posture and look at all these other patterns and behaviors.
Yeah.
And it's frustrating.
Yeah.
From a practitioner's point, you just want to get in there and do the PT and give, okay, let's realize this and walk on it and progress you. And you're getting held up by these, and lifestyle changes are slow and they're difficult, and they're not necessarily, they're not easy, I guess.
No. Definitely not. And that's why the oils have been fun, is because they kind of, we know it's going to be a long journey from injury to being healed. So having something naturally that can help support that without them, going off track completely because pain happened again or something like that.
Okay. And I had a couple more other questions. They're a little out of order, I guess, if I had organized my brain. But out of curiosity, how did you end up in Colorado from California?
Yeah. So my travel lists for PT school were Seattle and Denver. And I got the Seattle one and I never got the Denver one. I didn't get accepted to the rotation. And I had my own business in California and was coaching CrossFit and was working at a part-time clinic, and I was just ready to get out of California. And I had a friend who coached CrossFit out here, and he was like, why don't you come out here, bring your table, you can start here and then just expand. And so I was still at that point deciding if I wanted to move to Seattle or Denver. And there was actually a couple practitioners in Seattle doing what I wanted to do, and there was no one doing it in Denver. So I was like, well, heck, they need me in Denver.
Yeah, that's a good reason. Go where
Yeah.
you need it.
Yeah. So here I am.
And I can pick your brain after we get off the video, because I've been thinking about introducing or going into private practice in my own business, and pick your brain about just how you went about the technical parts of that.
Yeah.
And my other sort of background question is, how did you get into PT? Like, what's your PT story?
Yeah. So I had this amazing clinical instructor that just made me want to graduate. And
before that, back when you decided to apply to PT school.
I do have to give you credit though, because your knowledge of the SI joint like blew my mind, and that was like one of my favorite things to learn in school. So thank you.
Oh, my pleasure. We didn't, I felt like we didn't get it in school enough. Like, we just touched on it, and I had to kind of relearn it afterwards. So I'm more than happy to share what I learned.
So I grew up playing soccer and had really bad headaches in high school, and saw a bunch of doctors, did a bunch of tests, and it was physical therapy that ended up making it very manageable. So that kind of opened up my eyes to that career. And then just all the injuries that I had playing soccer in college too, hanging out in the training room and that kind of stuff. So, yep.
That'd do it, yeah.
I almost I wanted to be a vet for a little bit because I was at UC Davis, and they have a phenomenal vet school, and I just didn't want to put animals down. That was my one limiting. I didn't want to do that. Not that that's all they do, but that was what I didn't want to do. And they actually have a branch of animal physical therapy. Did you know that?
I've heard that.
Yeah. So I looked into it.
And massage as well. I feel like someone I know, I'm blanking on who it is, has said that they were interested in pursuing massage or physical therapy on animals.
Yeah. It's pretty cool, but they suggested, I shadowed a couple of them, and they said to work with humans first, so you really kind of solidify your skills, and because you can't talk to them.
Yeah.
They just bark at
you. How about this? Yeah. So, what do you have coming up that you might want to let people know about? I know you're in Colorado, so I have a few people in Colorado, but not that many. But you sometimes do online courses and things too. So do you have anything you want to let my people know about?
Yeah. So I'm actually heading to the East Coast this weekend to teach a couple of oil classes. If anyone's in Harrisburg or DC or Baltimore or Virginia, I'm popping over there. We do have
post those in the comments after we post the video.
Yeah. I'm going to be in a rental car all weekend, just driving around. But we have a essential oils for dogs class coming up. And what I can do is I can share the event in the group maybe, and people can join, and we can either FaceTime you in, or we'll probably just go live on there. So that's another one that's coming up. And then we have a couple classes for immune system, especially with kiddos and winter coming.
You got a lot coming.
Yeah, so I can share those in there.
Wonderful.
Yeah.
And you had sort of a special to offer my group members, right?
Yeah. So anybody who's interested in learning more about essential oils and wants to buy any, I am giving just for Erin's people this amazing recovery blend. Yeah, your people, your followers, your tribe. Yes.
Tribe. That's better.
This one's just a fun one to share with people for free because it's what got me into the essential oils. It's what took my PT practice on a more natural path, and it's just really fun. So you guys get that for free. So you could just private message me, or I can just pop my email into the group as well, whatever's easier.
Okay, so, and maybe I missed it. Was that free with purchase or just?
Free with purchase.
Yeah. So, okay.
So we'll go into more details on how you can buy oils, and usually kind of figuring out what your goals are, if it's sleep, digestion, mood, that kind of stuff.
Yeah, or dog health.
Dogs, yes.
I got a couple of dog lovers.
Yeah, I thought my dog was on the bed. She's not.
Awesome.
There she is.
Well, thank you so much for, I see sort of a dark spot moving around.
Yes. I'm all packing right now. I shouldn't show my bed.
Thanks for coming on and talking to us and letting us know a little bit more about your journey and essential oils. I love it.
Yeah, thanks for having me. That was
fun. Wait, we forgot to answer Nate's question. So Nate wanted to know, he's a trainer, so obviously he knows what he's talking about, and he's a trainer I used to work with at Pro Club. He's now, I believe, in Arizona.
Okay.
And he does a program called Bod in the Box, and I will probably interview him in the next upcoming weeks, and we'll learn more about that. But he's very tall. Obviously, he's lean and muscular body type because he's a trainer and he works out a lot. And so he lives his his story, and he was saying he's got sort of chronically tight hip flexors that can lead to low back pain. So he was wondering if we had any ideas for tight hip flexors. Well, besides, I'm sure he knows like some of the basics, but do we have any like special hip flexor tricks?
That's what I was wondering, if you had anything off the top of your head first, since you kind of know him and know what he does and what his background is.
Yeah, we should have him on here. I guess we're not live, so we can't have him commenting, but I would imagine he's just doing a regular, like maybe a lunge or something. I'm not sure.
That's
maybe something with some like eccentric contraction or something would be helpful.
Yeah, definitely. Maybe check out to see how he's walking too. A lot of people, because we sit so much, our butts are asleep. And
yeah, I don't think his butt's asleep. He's going to laugh at that later. He's shown some really good butt wake up exercises, so I don't think that's the problem, and I don't think he sits that much.
Okay. The other one, I don't know if you're familiar with visceral manipulation.
Yeah, I haven't done a whole lot of it, but I am familiar with it, and I know that's something that you've talked about before too.
Yeah, so that's kind of one of my other specialties. So I've noticed, and it totally makes sense because of where all the organs are, any type of large intestine, small intestine issue, digestion wise, will affect the hip flexor. So I get a lot of people who mobilize the heck out of it and stretch their hip flexor, but because they have a restriction in their intestines, it can kind of create those to continually protect.
That's a good tip.
Yeah. So there's a ball that he can get. It's called a Corgis ball that he can start to kind of roll on. It's really, really helpful.
Yeah, maybe he could do some self-massage on the iliacus as well.
Yep.
Which I'm going to stand up for a moment and see. For those of you, kind of dig your hands into your pelvis, and you can kind of poke them right inside the pelvis, and then you can even move your leg back and forward and back to kind of get the muscle to move underneath the pressure point, and you can move it, in different positions as well.
Yeah.
Well, that's a couple ideas for him.
Yeah.
And he can comment on this whenever we get on there, and let us know if he has any more questions.
Yeah.
Awesome. Well, thank you, Missy.
Yeah, thank you. Are you going to move to Denver and join me in private practice?
That would be fun, but no. I'm kind of tied down here with kids and husbands.
Understandable. Yeah.
One husband, sorry, I shouldn't say husband.
Yeah.
2 kids, one husband. That would be Utah, maybe.
Yeah. Yeah.
Sorry, bad joke.
Yeah. All right. Well, thank you for having me.
You're going to unrecord us?